All right, everybody. We are back with part two of week 6 of the introduction to CPT HCPCS coding. I'm Dr. Lisa L. Campbell. Let's dig in because you know how I feel about this lecture marathon. This part two, very short chapter on the endocrine system. And we got to look at terms, abbreviations, because this is a system. We will have some anatomy review. This book is a very basic CPT coding book, but I like the fact that it reviews anatomy because, you don't use it, you lose it. So I like that, right? And then we'll talk about some specific guidelines. So let's dig in. And so, first up, what is the endocrine system? The endocrine system consists of several different internal groups of glands and structures that produce or secrete hormones. What are hormones? Hormones are chemical substances produced by the body to keep the organs and tissues functioning properly. When structures of the endocrine system are not working like they're supposed to, and the hormones are not released like they're supposed to, illness occurs that may require intervention by the physician. So, the main function of the endocrine system is to keep the body in balance. So, the endocrine system is the top of the 60,000 series, and the codes themselves, you should note that not all of the endocrine glands are over in this family because some of the endocrine glands are in other chapters, right? So I had to come back on camera because, first of all, I don't want my big head in the way every time. But remember, we talked about the female and male reproductive system. Hint, 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 hint. All right. So in CPT, the main families of codes are going to be thyroid gland, parathyroid, thymus, adrenal glands, pancreas, carotid body. And then we also have um, laparoscopy codes. Now, no surprise there because we got those endoscopic codes everywhere, right? All right. So, looking at the thyroid gland, and of course, there's some abbreviations, right? We know that that's like a given. So, the thyroid gland, that's the gland that secretes hormones that regulate growth and metabolism. And the thyroid gland is an organ located in the neck with a lobe on either side of the larynx and trachea. We talked about larynx and trachea in, I don't know, one of those chapters where we did the respiratory system. In this family of codes, you have procedures for incision. So, yes, you have some incision and drainage. You have excision, so excision of a cyst, biopsy, but then you also have removal. And, removal, you can be removing a thyroid gland, a cyst, etc. And you'll want to pay close attention to words like total, subtotal, partial. So, are they doing a thyroid lobectomy or are they doing a thyroidectomy? So, you know what? Let me come back on camera so I can say this. I need you to like see my face when I'm saying this. Now is the time to learn, understand these words so that on the day of your national exam, you're not sitting there struggling. As a person who has taken 11, no, 12, maybe 14 national exams, currently hold 11 of them because I gave some up that I was no longer using. So, like, I was a medical assistant in 1992. I didn't keep that credential after like 2005. But nonetheless, on the day of the national exam, CCS or CCSP, you're not going to have a dictionary in front of you. You're not going to have access to Google. And so you need to have the information up here. And so one of the things I think is so very important is that as you're going through these journeys, just start to remember where things are, right? And I know you don't use it, you lose it. But so watch out for if it is a thyroid lobectomy or a thyroidectomy. Okay. All right. Under removal, we have one code, and this is for removal of or not removal, but aspiration and or injection of a thyroid cyst. And there are some notes. There's always some notes, right? That's nothing new. Other structures, you have the parathyroid. This is located along the posterior of the thyroid. There are actually two parathyroids on each lobe of the thyroid. And the thyroid is another structure that secretes hormones that regulate serum calcium levels. Okay. Then you also have the pancreas. The pancreas, you probably remember, because we talked about this in the digestive system, but the pancreas functions in the digestive system as well as the endocrine system. In the endocrine system, it is secreting insulin, which is a hormone that regulates blood sugar levels. And when the pancreas is not functioning properly, or in some cases, not even at all, the patient is diagnosed with diabetes. And you know diabetes from your diagnosis coding course. All right. We also have the thymus gland that's located in the middle of the chest, just underneath the sternum. The function is to secrete thymosin, which is a hormone that the bone marrow needs to produce T cells that work within the immune system. So when I think of T cells, I immediately think about um, AIDS and how a T cell count can be lower. All right, then we have the adrenal glands, and the adrenal glands sit on top of like a top at the top of the kidneys. Their function is to regulate electrolytes and help in the metabolism of glucose and adrenaline, which plays an important role in heart and lung function. Um, Procedures that are completed on the parathyroid, thymus, and adrenal glands and the carotid body, which is a term you probably remember from PCS coding, are in the range of code 60500 to 60605. All right, so these are the actual ranges of codes. Some of them are add on codes. And in case you're wondering, do we got some transplant, something another? You know we do. All right. So then finally, laparoscopy or other procedures, we have a surgical laparoscopy with adrenalectomy, partial or complete, or exploring the adrenal gland with or without biopsy. And then it's organized by transabdominal, lumbar, or dorsal. Review the information prior to that code. We have 60659, which is unlisted procedure. And you should know, I gotta come back so you can see my eyeballs. You should know by now that whenever you are planning to use an unlisted code, that means that you have looked at the codes in that family, nothing is available. This is real world. You looked at category 3, nothing is available. And now you're having to use an unlisted code. Unlisted codes do not have reimbursement tied to them. You have to submit what is known as a special report and blah, 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 blah. All right. So then we have ablation of thyroid nodules, and then we have another unlisted code, and we are done with this chapter. The abbreviations weren't on the slides this time, but they're in the book. And I'll see you in, where will I see you? Part number 3 of 5. So this is actually our last week in surgery. After that, we're going to go and see some other sections of CPT happy coding. I'll be back with part 3.